Welcome to Jasiri this Thursday. Just one more day to go before Friday, so hang in there. We're almost at the weekend. Whether you're wrapping up the week or counting down the hours, we've got some great conversations lined up to help you finish strong. So grab a seat, get comfortable. Let's dive into today's show with insights that will carry you right into Friday with a fresh perspective. That sounds like a toothpaste ad. Anyway, my ladies are here. Let me ask you something, ladies. When was the last time you got cash from an ATM?
Oh. Oh, I wasn't expecting that.
As in, have you been getting cash from it when you
I don't even know, but the last time I went to an ATM.
Teacher, yes, Lolo.
I'm very happy for the opportunity to answer this question. The last time I tried was about 3 months ago at somewhere around 7-Up, and I found out that you can only take as much as 5,000 per withdrawal.
And that wasn't from your bank directly, was it?
It was from my bank directly, from the ATM. You know.
Just 5,000 naira.
Yes, because
so if you want to take 50K, you do that 10 times.
That's if you can.
Oh, wow.
I think the maximum you can do is about maybe 20,000. Yeah. And I'm wondering why.
Yeah, why?
Because there are POSs everywhere. And of course there are charges on what they're doing.
Yeah.
So I guess some of them are just allowing the POS business to thrive.
And it's looking a lot like in Nigeria when there's an alternative, we relax on the actual option.
Yes.
Because we should be able to withdraw from ATMs, but now it's as though the ATM and the banks are like, okay, since they're POS, just use ATM. So now you hardly even see functional ATMs, you hardly see money in the ATM because they believe that, oh, people should have POS. So it's either you withdraw from a POS or a lot of people don't even want cash anymore.
I use
weird. I don't have cash. Like I cannot remember the last time I held
that is also
physical cash.
Yeah.
I just don't.
You
have
buy
it.
groceries. Some of us go to market, and some market women still say they don't have ATM, and they will now make you go to an ATM, a POS machine, pay the charges.
The charges are higher for the POS, aren't they?
I think I want to believe so.
Yeah, because if you're taking directly from your bank, it's supposed to be free.
Yes,
no
never free.
That's why when I have the opportunity to go to, there's a bank I use, it's largely blue and white. So when I go there, I always make sure I stop by the ATM. And funnily enough, I've withdrawn cash. It was strange to me because it gave me 20,000, and I looked at the money like, yo, I haven't had this money in this kind of way in a long time. Because when you go to POS, you're either withdrawing depending on the charges. 5,000 attracts 100.
200. In my area, it's 5,000 is 200.
Oh wow.
So, well, listen, a post from an ex-user is what ignited an interesting debt on ATMs and POSs. Fakus Hashim said, and I quote, "I need the CBN to destroy this business of POS. Bring back ATMs, WTF." I would love to say that. End of quote. She goes further to say it's so bad that airports do not have ATMs, not at malls, nowhere. I hardly ever pay cash, yet the level of disorganization of these projects. We are living with the realities of many failures, and that's what this proliferation is. So that there was a
thread.
Of reactions from this. Nigerians are really a defeated people. Sorry, we can't go from the prevalence of ATM to
POS vendors being the only option in this big 2024.
Are we moving backwards or what?
Or what?
Banks take your money on a commitment to give you any time you ask. When you ask, they imply you go get it from a random stranger with charges attached to it. The bank is breaching its, biggest commitment and punishing you for it on top. Yet you think it's okay because it's convenient.
So clearly these people are not in support of, what
POS.
You're absolutely right. It's frustrating that essential places like airports and malls do not have ATMs available when we need them. It really highlights a lack of infrastructure and planning. Relying so heavily on POS and mobile payments, especially when they are not always reliable, just shows how much we're dealing with disorganization and inefficiency. The whole situation is a result of many systemic failures, and it's definitely impacting everyone trying to navigate daily life. Just wait till December. You're right. Sometimes, forget I have an ATM and I realize it's mostly POS vendors. ATMs don't have cash in them anymore. You can drive long distances and not see any with money, but POS vendors always have the cash.
Exactly. That's the point I was going to drive at.
Yeah.
So this This person says that.
So on the flip side,
yeah, there's some
these are
supporting
supporting
reactions.
reactions. This one says paying 200 to withdraw 5,000 sounds inexpensive, but it's a 4% fee. That's exorbitant. If POS are a better option for most people, then ATM liberalization shouldn't affect them, as people will still choose the most convenient option for them. Why can't they coexist?
They have a point.
Very valid points. This one says there are LG headquarters and many small towns and villages with just one bank. POS operation has been a
savior.
Exactly.
Yeah.
Okay, so
So it feels like, you know, there's
POS is
people
the
for...
reason, sorry.
Yeah.
POS is the reason why some people can feed their families and not go hungry. If the ATM is your preferred choice, use it. If it's POS, use it. Don't bring people down because you don't want to pay 100 naira charges. I think this is almost like saying let them coexist together.
Yeah.
But I don't know how...
so left for me, I would even
Now, who ATM never swallowed their card? They stop this kind of thing. I hate any issue that will take me to the bank. POS will go nowhere in Jesus' name. For real, for real.
Yeah, so
But that is the reality of life.
Yes.
Some people will be pro something and some will be against it.
If anything, I would even say ATMs should just lock them up, because someone else was saying POS and the actual bank withdrawals are unreliable. Have you tried ATMs? Like, you go
Your
there,
card can
it's a
go,
50-50 chance that you
get money.
Yeah.
It's a 50-50 chance that it will swallow your card, like
Yes.
this guy
Yes.
said. And once it swallows your card, you're back in the bank.
Bank again.
The stress we are trying to avoid. I mean, we are at the level where people are... There was a day I was driving in traffic and I was like, I wish they had POS machines in traffic. Because people will do anything to bypass that stress. The stress of standing, and the few ATMs, it's just like fuel queues. The few ATMs that would have the
They have
cash,
such
the
long queues.
You can't
exactly.
even rely on ATMs for in an emergency because you're going to be in dire straits. Because you go there would never be money. Or it will not even be
Or you
functional.
spend like 3 hours there waiting to get your turn.
Have you ever been to an
ATM?
ATM in the bank that is just dysfunctional? You keep calling the security man or somebody to come and help you unravel what's happening with the ATM, and those ones will come in their uniform.
Or you stand in front of
totally
the...
clueless.
You stand in front of the
Say,
machine
madam,
and then... You know that song it
did
sings?
you put your pin?
You sing that song, or you're waiting and then you start dancing to the
Oh
song.
my God. And they will even call, madam, did you put your pin?
Oh, yeah, it's like, no,
Bring
I
out
didn't.
your card. I'll be looking
And
at
let's
it.
not forget the hazards of, because we've heard stories of people going to the ATM machine to withdraw at night and getting
And they get
robbed.
robbed.
Yes.
So there's also that, where there's no queue, you're there,
So
you're
you will not
happy
rob
that
at
it's
where a
paying.
POS vendor is. at
The
night?
chances are slimmer, I won't
Chances
lie.
are-
Can you even
If you're
find them at
dealing
night?
with a
though?
human being.
POS vendors, can you find them at night?
You can.
You can
You
find them
find
midnight.
anytime.
You know
Yeah.
my estate,
So
there's
how
a
come
petrol
they're not
station.
robbed?
That's what I was
in
about
the
to say,
places
because
that-
there's
Why?
actually
Yeah,
higher.
boys
There's actually a
protect them.
higher potential for robbing. Why? Because with the ATMs, at least they are attached to some sort of establishment. They're attached to a bank. There's supposed to be a security guard there. So it never ever. Thank you.
supposed
Never
to be
works.
unarmed.
But the POS people, they're just
So how can they
individuals.
save you?
Yeah.
But there was a time where POS, where ATMs were working perfectly.
Yes.
Whether it's from your bank or
But you know
other
the
banks.
advent of this POS started during COVID, where it was difficult, and during that election time,
really?
No,
it
it's
thrived.
been in existence, but I think
Yeah.
No.
COVID made people more relaxed,
Yeah.
you know, to
It thrived in those times when there was scarcity of cash. Remember?
Where the naira,
Where the
we're
naira that you
changing,
were
yeah,
even
from
paying
the-
inside bank, you could hardly get your money.
When
The
they
naira.
changed the
Naira
They were
notes,
trying
notes,
to
yeah.
introduce new naira notes
They made a
when there
killing
was
then.
scarcity of cash physically.
Because
that
you know,
was
we're
when all
always
these
doing the
smaller
thing that matters most in this country.
online
That's our
banks.
government's, that's their strength.
No, but it seems that these online banks are even more efficient than your established banks.
Oh, you mean what the microphone?
No, this
online bank. You know,
online banks.
Someone said that, and no, someone said that if you're with an online bank and she asks you for your details and you give her an online bank account
She won't pay.
number, she won't take you. It
Why?
automatically makes her look at you in a certain way.
Okay, but her money was stuck in the bigger banks that are not online banks.
And some of
as
those,
at from a few weeks ago.
But
and
they're
some of those banks you
quicker.
can't even make like
Have you
international
even- have you
transactions.
ever
With
used
these
one of
ones
these-
you can. Yeah,
This-
they give you a digital card and you can make international transactions without
Even this POS
banging your head
seems
against it.
faster. Some of these online bank activities or the transactions seem faster.
I think it's
if
just
you use
because-
one of them, you'll get instant.
Yes. Yes.
But if
And-
you
and
use
that's
some of
what-
these established bank, you can
You'll
be
be
sure
there.
that some of them are not even deliver.
Yes.
You'll be there.
Last, in fact, I was in a boat in a high hailing car
E-hailing, yeah.
yesterday. And I did transfer from one bank to the other, like 20 minutes before I got to where I was going.
Yeah.
I can assure you, by the time it was dropping me at home, it hasn't even dropped.
There are some vendors now that sell
worse
things that when you use these online banks, they tell you, oh, have you sent your okay, you can go.
Yeah.
But if it's the other one, they say, wait, we've not gotten it because we may not.
They lock you in the vehicle.
Of course, I bought a duvet some weeks ago. I told you guys that I paid, and it didn't deliver for over 1 week.
Wonderful.
Why?
1 week.
It didn't drop.
It didn't drop. In fact, thank God that we didn't even take the duvet. The woman was looking at us like scammers. Like, where is this your audio? Where is this audio money that you said you paid? So I was showing her my the receipt from my phone, because all these banks, with this upgrade they did on some of their mobile apps, it's still not functional effectively.
You don't trigger us to call out a certain bank
Yes,
name, because there was I think a very trepidatious 2 weeks that we faced with a particular bank. It's
not just one, no.
Name.
They are all the
We
same.
know it.
As that trepidatious one was doing that, another audacious one was gearing up to continue in this precarious journey. Wow.
Ubiquitous.
Even you said, Sorry, let's move.
So across the table, POS ATM.
ATM, sure.
POS ATM. POS ATM.
Cash.
Okay, let's go.
What did you
She
say?
said cash. Well, this is a really, really interesting debate, because, I mean, why can't, two people coexist side by side? I think, whatever works for you, just do that.
Yeah.
Tolu, who isn't here, always says that something that makes sense in this situation is what we're going to go with. Wherever you see something not functioning the way it should in Nigeria, just know that there are people making money from the dysfunction. All right, POSs have their uses in the rural areas and certain places, but we should be able to get to the ATMs and use them in cities like Lagos and wherever else. So we're going to take a quick break right now. When we come back, we will keep on with the show. Please stay tuned. You are watching Jasiri. Welcome back to the show. Please join the conversation. Our social media platforms, you can find us at News Central TV. With all the things happening in Nigeria, one advice that Nigerians are giving each other is, please don't fall sick. This advice is about eating well or getting enough sleep. This advice comes from the realization that Nigeria's healthcare systems across the board, all three levels of government, are failing. Anytime we have a conversation about the state of Nigeria's healthcare system, I can't get over the fact that we have just about 55,000 licensed doctors left to serve our population of over 200 million people. According to the Minister of Health and Social Welfare, Dr. Mohammed Pate, about 16,000 doctors left the country in the last 5 years, and about 17,000 have been transferred. But he said this in March of this year. Imagine how many more have left since then. Just imagine.
So many issues.
Yeah.
There are so many issues when it comes to Nigeria's health sector. The SBM Health Preparedness Index 2024 has probed the readiness of states to address public health crisis. Key issues in Nigeria's healthcare sector include high maternal rate and child mortality rates, widespread infectious diseases, and insufficient healthcare infrastructure. Additional factors like multidimensional poverty and economic hardships further hinder the system, resulting in the limited access to healthcare and leading to high cost for both medication and treatment. Report emphasizes the need for increased and sustained investments across all regions. But as Annie said yesterday, the devil is in the details. Joining us today is a beautiful woman, very beautiful name. She is Bumi Bailey, the head of research at SBM Intelligence. Bumi Bailey, please welcome to Jasiri.
Welcome.
I just told her off the camera, her name is intoxicating.
No, you get a certain kind of high.
Yeah. All right. right, Bumi, maybe we should just get to it. When it comes to the health status of Nigerian states, I think we should start by painting a picture of where things stand when it comes to health preparedness. It's very important that we know health preparedness. How deep is the hole that we're in? Because I can see a gully. But I don't know how deep that gully goes. Please enlighten us.
Okay, thank you for having me in the show once again. Okay, you talk about how deep we are. Well, let me just dive through the report we did. I think it was actually released last month. So the report, which is the third edition of our report, actually looks at how, you know, apart from Nigeria, the states in the country, how they are prepared in terms of maybe future pandemics and also diseases, and then you also have health emergencies. So what we discovered was that last year, about 36 states out of maybe about 9.17 trillion that was budgeted for 36 states. About, let's say, 776 billion was allocated to health. That was for 2023. And this is an increase from about 314 billion in 2021. So we noticed that, okay, fine, there's a surge in health allocation, which is actually an improvement. But what we actually noticed that in terms of our health preparedness for the states, all of the 36 states did not even score above 26. What am I saying? 20? I'm saying 25. They all scored
over. Is that over 50 or
over 100? Over 100. That's actually a fail. Right? So it just clearly shows that we are not actually prepared. The hole is actually still very deep. I mean, I'd expected that, okay, fine, you've increased expenditure, fine. But what next have you done? I mean, you actually talked about the fact that I think you said 55 doctors are licensed and the number of doctors have left. I mean, it actually says a lot. So the thing is that it's not just, you have to go beyond just allocating to the health sector. So how do we check how these processes are done, especially for doctors? Doctors are complaining about the poor working conditions. We talked about the low fee. That's why you have them going up and down, doing strikes all over the country. I mean, the number of doctors we have, the specialized doctors, and then we have a lot of graduates turning out in schools. Where, I mean, do we even have enough to actually teach these young ones that are coming out from school? So it actually shows that we are not prepared. I mean, do we have to rely on these ones when the number of doctor to patient ratio is very low? No. So from the analysis, the states are not yet prepared. Like I said, none of them got above 26%.
Wow. Wow.
That's very frightening. So, Dr. Bumi, we want to ask, what about Nigeria's health indicators? Where do we stand when it comes to life expectancy, maternal mortality, under 5 mortality? There's so many, specific groups that are high risk. So where do we stand when it comes to these persistent infectious diseases and, other critical health indicators?
Okay, so when it comes to life expectancy rates, I think I saw a data from Microtrends that said that life expectancy has rose to about 56 years. That's from 55, but it's still very low. Yeah. Still very low. I mean, we have other countries that are doing maybe 73, 75. I mean, the UN has a projection of increasing life expectancy to about maybe 73 years. Yes. I mean, we're still very below that target, right? Even though it's like a 2030 target. Apart from that, you have the under 5 mortality rate. I mean, it's still very high. You talk about mothers dying through childbirth, it's still very high. I think the recent data, the number, it's about under mortality rates. I think it's around 1,047 deaths. That is per 100,000 live births. So you can actually see that these numbers are still very high. And it actually pictures or mirrors the challenges that are still in the sector. Let me even bust your bubble again. I mean, you also talked about the high cost of drugs, right? I mean, right now, inflations are at record high, especially food inflation. I mean, food inflation is about 37.7% in September. It rose right after declining for 2 straight months. That's between July and August, right? And then when your food inflation is rising, right, for a for a number of maybe population of over maybe 200 million people. That actually says a lot. It shows that food is becoming less accessible to many Nigerians. And then now you see many Nigerians now reducing their food intake. I mean, when your food intake is reduced, do you know what that means to your balanced diet, right? I mean, National Bureau of Statistics said that the cost of a healthy diet for an average Nigerian, it rose to, in fact, it more than doubled in 1 year to about maybe 1,346 naira per day.
Per day.
So you can see that, and this is from 631 naira.
So
in
1,000
September.
plus per day per person per meal, or for the entire 3 meals?
No, for one person.
For one
person. So the thing is that in September, the cost rose to about, that's the balanced diet, about 1,346. And that's an increase from about 631 in September last year. And that's a huge spike.
So I'm sorry to cut you. So you're saying that with 1,000, maybe 300, a person can eat a balanced meal in this country now?
No,
That's what
so what I'm trying to,
Yeah.
that's an average. So what I'm trying to say is that the spike in
It's
that
way
cost
high.
shows that they
Yeah.
cannot afford it, right? I mean, you have a number of people that has cut down their food cost. I mean, before, I would say it is one.
Yeah.
Breakfast,
Yes, so
lunch, dinner. Now,
0, 0.
then
We
it's
started
now,
101,
exactly, 101.
101.
Exactly. So that actually shows that they are not getting enough nutrients in their body. And when you're not getting enough nutrients in your body, your immune system becomes weak. And when your immune system becomes weak, you become sicker. And when you are sicker, especially for a worker, or a typical Nigerian worker, your productivity reduces. And when your productivity reduces, economic activity reduces. So all these have
It's a ripple
an
effect.
impact. Exactly. I mean, human capital development is an important indicator, right? It's for any economy. So like I said, I hope that when we do our next index next year, there will be an improvement, not just seeing rising increase in expenditure. And then just to note, the increase in expenditure is mainly from inflation. It's not because of, I would not suggest that maybe they actually want to do it, but it's just inflation. I mean, if we are seeing an increase in expenditure, we need to see the impact. But clearly,
We haven't
we are
seen
not
it yet.
seeing it yet.
Okay, so I think that we've laid the foundation on why health preparedness is very important, right? But I would like for you to take us through the indicators that were used when this index was being prepared. What were the things that you considered? What were the things that we looked at?
Okay, so we looked at 7 indicators, right? We looked at doctor to patient ratio. That took about 30 points. So we looked at life expectancy rate. We looked at under 5 mortality rates. That took about 25 points. That's for life expectancy and mortality rate. And then we also looked at health human capital index. Took about 10 points. We looked at immunization coverage among child within the ages of 12 to about maybe 44 months. And then we also looked at the health budget per capita. And then we looked at the average family. That's about maybe roughly 5. Thank you.
Wow, when you're looking at all the factors, indicators that they're doing, it's very, very, it just makes your heart sink all the time.
Yeah.
Anyway, so what did the research and eventual data tell you when you analyze health budgets across Nigeria? Because if we look at it based on states, I'm sure the indicators will be different from state to state. Let's look at funding first in regards to this. So who are the top 5 spenders? Who are the top spenders, the odogus of chopping health money? And who is in the bottom? Because we have to look at, even though there's a budget, it's allocated to states in different capacities, based maybe, I don't know what criteria they use, but who are the top spenders and who are at the bottom of it? Maybe we'll cuckoo dub the state the most, the healthiest states in Nigeria.
By how much they spend?
Even so, surprisingly, people actually felt that Lagos, which actually ranked #1 in the index, right? In the index, still got F. You know, they still retained the position, but they recorded a decline in health allocation from 2021 to 2023. So looking at the top states that recorded, what we looked at was not the highest. We looked at the growth. Because even though it's actually very high, it's good, but what actually you need to pay attention to is the pace of growth in terms of expenditure. I mean, for example, the top 5 states that recorded a surge in an increase in health expenditure is Cross River State. I mean, Cross River State rose to about they allocated about 22.1% of their budgets to health, from about maybe, let's say, 2-3% in 2021.
Wow.
Yeah, that's a huge significance. Yeah, and then the rest of the states, in fact, they are northern states, which is surprising. Right, I mean, you have Bauchi, you have Kaduna, you have Zamfara, and you have Sokoto. I mean, these states allocated about, let's say, close to 15 to 13%. And this is from about, let's say, 0 to 2% in the previous year. So that says a lot. But these states were still, like the northern states, were still at the bottom of the index. I mean, you have Sokoto, you'll be not getting more than 215 points in our health preparedness index. So it just highlights that I found these states have increased their allocation, but in terms of preparing for epidemics, you know, health emergencies and co, they are still not prepared. And then when you look at the bottom 5, I mean, this is where Lagos goes. Okay, Lagos, yes, Lagos allocated about, let's say, maybe 4.64% to health. And there's an increase of maybe, let's say, about 2 or 3, yeah. And then after Lagos, you have, in fact, the rest are maybe 2 or 3 about in the southwest. You have Oyo, you have Osun, you have Ebonyi, right? You have Ekiti, you have Bayelsa. So those guys were in the bottom 5.
Wow.
All right, we're having a really good conversation, but we're going to take a quick break here. And when we come back, we will continue talking about the preparedness of the states and the budgets as well. So please stay with us. Jasiri will be right back. Welcome back to the show. Don't forget to join the conversation via our social media platforms. We are at News Central TV. Our conversation today focuses on the preparedness of Nigerian people and states when it comes to health issues. Our guest is Bumi Bailey, head of research at SBM Intelligence, a leading African-focused market intelligence, security analysis, and strategic consulting firm. We know that Nigerians are facing deepening socioeconomic problems, which have further exacerbated the health sector's struggles. Multidimensional poverty, rising inflation, and declining incomes have made healthcare increasingly inaccessible for many Nigerians. How do declining incomes impact the preparedness of the states, Bumi?
All right, so our guest is still here with us, and I just want to quickly piggyback off what Annie said, but this time as a question by the side. Now, Bumi, what consequences, as we are seeing it, as it concerns the health of Nigerians and declining income, what are the consequences of economic hardships on the people? What choices are the people making because of the hard times? I know for a fact that people have cut down on their budget, and not just people, I am people, you know, people are me. So what are the consequences on the average man?
Okay, so I think earlier last month, the World Bank said that the high inflation rate actually pushed more people into poverty. I mean, from December last year to about maybe June this year, about 25 million people have been pushed into the poverty net. So that actually shows that currently the poverty numbers has risen to about 125 million naira. You understand? I mean, this just actually mirrors the current situation in the economy. People don't have enough money to feed. I mean, we talked about Nigerians reducing their food intake. So what they will try to do is they will, in a way, try to prioritize what is most important. I mean, food and transportation takes a huge component of a consumer's budget. And then apart from that, you have health. I mean, look at, if you know, last year, the high, in fact, one of the things that affected the health sector is the high cost of FX. I mean, when the reform, in fact, before we had the FX reform last year, I mean, the FX was affecting the cost of drugs, but when we had the FX reform, it surged the cost of drugs. I mean, it became less accessible for people to get those drugs. I mean, they will say that in this economy, in fact, it's actually scary for you to fall ill because you can't be able to afford the drugs that you need. I mean, when GSK left announced that they were going to leave last year, they talked about the FX. The FX is affecting the cost of input because most of the drugs we take in these countries are imported. You know, when they are, and then because we rely so much on the FX, high cost of FX, it increases the drugs, right? And then pharmacies are saying that they cannot be able to import, which reduces the quantity, which leads to scarcity, which increases the high cost of drugs. I mean, right now we see people now going towards herbs.
Yeah,
Local herbs, traditional medicine. And in a way, I really don't know how this is actually good for the body system in terms of other drugs, right? I don't know how this is actually potent for their system. You know, back to what we talked about, how the average men are feeling. We talked about people are reducing their food intake. That's how they are trying to survive. They are cutting back on exactly they're cutting back on essentials, right? And one of the things they're cutting back on, food is essential, but they are reducing the quantities of food. I mean, a crate of egg right now is roughly around close to about 6,000 to 7,000. Yes. And you know that eggs is an important potentially for kids. Yeah. I mean, looking at the most of the food items has increased maybe in the last 1 year, is most of them are stable foods, everyday consumer foods that Nigerians actually need to be able to carry out their daily activities, right? So right now, Nigerians cannot afford enough, right? And then right now, like I earlier said, their immune systems will be attacked because now they are now going towards all these herbs and drugs. Although maybe this year, I think drugs are still high, but they are not rising as much, right? They are still high, but they are not rising, but still, like I said, measures have to be taken, must be done to reduce this. I mean, it's beyond just, okay, investing, it's beyond just allocating. I know that I read recently that World Bank just approved about maybe $1.57 million to improve health education and infrastructure. Most of that funding went to health. So right now, I think that Nigeria has a lot of funding to the health sector. But right now, how do we efficiently utilize these resources? I mean, it goes beyond just, increasing the allocation. How do we check if these resources go to the right people? For example, those are complaining about salaries. Okay, is this money increasing the salaries of doctors? I mean, in any economy, I mean, doctors are one of the most important careers, even occupations in any economy. That's why you see the likes of UK and Canada looking at Nigeria as a fertile ground to pluck these guys. And when they are plucking them from the country, what are we left with? So these guys are actually seeing the value of the talents we have here, but we are not really seeing the value. So this is the time that government needs to intensify its efforts, right? And be able to channel those funding to those right places. And apart from that, okay, like I talked about, not even on the health sector, in all sectors, whatever palliatives you give or subsidies you give to any sector, do a check analysis, you know, hold people accountable if this doesn't go to the right channels. And I believe most of our health challenges will be solved. So that's why I said by next year, when we do our next report, I hope to see an improvement. I mean, I don't want to see F9. I hope to see maybe a D or C.
You are not even going to pass it. You know, because time is really running. I wanted us to look at, you know, when we look at places like Lagos, Ogun, Ekiti, you say they rank high in their failed, among the failed, you know, level of preparedness, reflecting, that means we are reflecting, looking at the budget allocation and healthcare outcomes. However, other states, especially in the northern side of Nigeria, continue to face like a significant deficit when it comes to healthcare, infrastructure, resources, medical staff. All this thing is part of why they are failing. We all know that. I will know that the state of the economy, of course, has led to the exodus, just as you mentioned, of pharmaceutical companies from Nigeria, and this is why the cost of medication, drugs are going up. And coupled with the fact that we're already having brain drain, so it's as if the healthcare sector is being punched from all sides. Or are we to add the dilapidated infrastructure or inadequate compensation? Because we know how the government have been jostling with JOISU, you know, Medical Association of Nigeria, all those things. All these things are part of the things that are giving the healthcare sector a lot of trouble. But what can we do, these sectors do, to be able to, you know, kind of mitigate all the hits that they are getting? At least, especially when we need to consider our level of preparedness when it comes to infectious diseases and healthcare emergencies. Remember, we've had, Africa has had Ebola. We've dealt with COVID. Recently, we've dealt with cholera. And who knows, I'm hoping tuberculosis and all those. Monkeypox was around also. Yeah. Tuberculosis is still coasting quietly. Those are the things that concern me, because emergencies are not things that are even recorded as part of the things you're preparing for.
Yeah.
But these are things that happen with no prior notice sometimes. So how do we mitigate these kinds of things?
So let me just dissect it this way. I mean, when you talked about you asked about indicators. I talked about how doctors and patients got about 30 points, while the rest, life expectancy and under 5 mortality rate, got 25%. So you could actually see that these 3 indicators got huge points, which now affected most of the states to actually drop and record the F9 parallel in their score. So I think what we need to do is that we actually need to look at the doctors and patients ratio. I mean, it just shows that you don't have enough doctors and enough patients. You know, doctors, like I said, they're going on strike complaining. We have other countries like UK, you know, taking our talents to actually build their own health sector and improve their economy, right? So what we need to do is to identify the challenges in that segment. You know, I mean, doctors have been complaining about the low pay, right? Okay, what we need to do is we need to increase the pay. I mean, I know for a fact right now inflation is rising faster more than the increase in incomes. You know, that actually says a lot, because that actually just shows the affordability of Nigerians. It has actually shrunk.
It is really, really, really
right.
shrunk, yeah.
So, like I said, you have to look at that segment, doctors to patient record, find out the problems of the doctor, their challenges, and solve it. I mean, it's very bad that, in fact, the health sector is education and health are the major important sectors in any economy. So, with the fact that you are not really paying a lot of attention, you know, in terms of impact, to see how far your funds are going, it's actually a shame. Right?
It really is.
So,
really
like
is.
I said, just those, like, one thing that the doctors have complained is about the pay, the poor working conditions. Solve that, try and find a way to solve that. Like I said, the World Bank recently approved about 1.57 billion to 3 sectors. Most of the allocation is meant for health. So they should find a way to channel that money to those places.
You really couldn't have said it better. And, you know, we have so many more questions to ask you, Bumi. And honestly, if we could stay here for 2 hours, we would, but we cannot. We have to go. Maybe when you come again, you will tell us some solutions that we can actually apply to help with these issues that we're facing with. Right now, however, we do have to be leaving the studio. Thank you to everyone who's tuned in. Thank you for watching us. We will be back again tomorrow, same time, same station. Join us again. Bye-bye.